Hello, my name is Dr. Sharan Kaur. I am a preventive medicine practitioner and I have a clinic in Subang Jaya, and I incorporate bioidentical hormone replacement therapy for my patients, irrespective of their conditions and their symptoms. We have here today Dr. Neal Rouzier from USA, and he will be having a chit-chat with me. We're going to have a little bit of a dialogue talking about hormones and how good it is, and how do we prevent diseases and metabolic diseases and even cancers using bioidentical hormone replacement therapy. Dr. Neal, I want to talk about the stigma of hormones. The minute a patient hears the word hormones, they freak out, they panic, they run out the door and say, oh, hormones gives me cancer. What is your take on that?
The response is not uncommon, and that is because the synthetic hormones have a very negative connotation based on a couple studies that showed that synthetic hormones cause cancer, heart attacks, strokes, etc. They're bad. And as a result, the world, meaning patients as well as doctors, fear hormones. And they say, oh, I don't want to take hormones. Hormones are bad. I'm afraid of hormones. Why would we give you something that was harmful?
Exactly.
We don't do that. But they conceptualize that it's harmful based on the WHI Women's Health Initiative study that showed that hormones were harmful. True, synthetic chemically altered drugs or hormones that were used in these studies were proven to be harmful. We don't use those drugs. That does not factor into our treatment whatsoever. All we're simply doing is replacing the hormones that our body normally makes. It's good. Those hormones are good. There's health benefits to those hormones. There's no harm. There's only benefits. But don't extrapolate the harm of the synthetic hormones to the bioidentical hormones that we commonly replace and we lose as we get older, and we simply replace or optimize those hormones that our body normally makes. There's health benefits, feel-good benefits to the bioidentical hormones. They are not harmful like the synthetic chemically altered hormones that everyone thinks that we're prescribing. We don't do that. We're not going to prescribe something that's harmful or detrimental to your health. We only are going to prescribe something that's very beneficial to your health, but patients don't know that because of the myth of the WHI trial showing that they're harmful. What we do is not harmful. It's worlds apart from the synthetic chemically altered harmful hormones. What we replace are the same identical hormones that our body normally makes, and that's always good.
Yes, that's true. I mean, I try to educate my patients and say there's a big difference between synthetic, which is chemically modified, and also bioidentical, which is similar to our own structure. It mimics the same molecular structure as our body's hormones, isn't it?
It doesn't mimic, it is. It's identical to the hormones that our body normally makes.
Right.
We're just raising the levels to a higher, more optimal range. Why? Because the medical literature says that that's what we should do for health and wellness. Why? Because all these studies show that you'll feel and function so much better when you optimize and raise your own hormone levels. But patients still have a negative connotation when you say the word hormone. Doctors have a negative impression when they hear the word hormones. Well, if hormones were so bad, we'd wipe out all the hormones in our body.
Exactly.
But that's what happens as we get older, we lose our hormones, and that's bad. It's not good for us. And every study shows when you replace those and augment those levels to that which we had when we were younger, there's health benefits, feel-good benefits, and we're going to talk about all of the benefits that we have seen, both in the medical literature and studies, but also that you and I have seen clinically in our patients.
Correct, I agree with that. And talking about reference ranges, you know how in Malaysia, the reference ranges are very short. Like if we were looking at thyroid, we're looking at a 3.5 to a 6.5. And here we are trying to get a patient to an optimal range more than 6.5, but then they freak out and they say, oh, but it's within the range, it shouldn't be normal, wouldn't that be normal? And then here I am trying to explain to the patients, I'm not looking at a 3.5 to a 6.5. I'm looking at you when you were 20 years old, where the reference range was a 5 to 9. I'm trying to get you to a 9, at least a 9.
It is very confusing for patients and for doctors when they see that range on the lab slip. And we try to educate the patient from the very beginning that if you want to have normal levels for your age, then don't take anything, and your level's going to be perfectly normal for your age. So what does that normal mean? The normal that's on the lab slip is an average of a population of old, sick people. If you want to have the same hormone level of an old, sick person, then keep your level in that range that's on that lab slip. But when you're 20 years of age, your level's twice that high. You did fine with that. In fact, you felt great. But that's not the range on the lab slip, because the range on that lab slip is based on the person's age.
Yes.
Not what's optimal, not what's best for the patient, not where they're going to feel the best or function the best. It's an average of a population of old, sick people, which is exactly where you do not want to be. We want to be optimal, the upper end of the range of a young adult. All the literature and science says optimize your levels to the level of a young adult, of a 20-year-old, and that's what we simply do. But then the lab test comes back reading high, and the doctor and patient may be upset with that, but they are not aware, because they haven't been taught or trained, that normal is not optimal. We're trying to optimize. That's where the benefit is, not staying normal. Everyone has normal levels. You're going to feel and function just as bad as everyone else with levels that are normal. You want to be optimal, the upper end of the range for a young adult, if you want to feel and function better. But that level is going to be high in comparison with that of an old, sick person that's printed on the lab slip, without belaboring it any further.
Okay, I hope the patients can understand that. Trying to explain it to them is rather difficult, but then, we learn it from you, and we're trying to explain it to them that optimizing your level is what we're looking at, and not just a normal reference range. And another thing is side effects. So patients
what
get
side
worried
effect?
about side effects. They
what side
talk
effect?
about hormones give me cancer, hormone makes me put on weight, hormones make me bloated, hormones give me acne. I mean, they're only focused on side effects, and I tell them, if you're taking a synthetic hormone, yes, there will be side effects, there will be complications as well. But if you're going to be taking bioidentical hormone replacement therapy, the only side effect will be you feel good.
The reason that the drug companies make synthetic chemically altered hormone is so that they can patent it and profit from it. Why don't they make a bioidentical hormone? Because they can't patent it and profit from it. So they will use chemically altered drugs, which we now know have side effects and problems associated with them. That's why we don't use synthetic hormones. We agree they're bad, and we're not going to give you anything that's bad. They are completely different, but they will think that the synthetic chemically altered hormones with the side effects and problems and complications are going to be seen with the bioidentical hormones, and there's nothing further from the truth. What we do is not what the standard doctor has done that shows harm. We're not going to give you something that's harmful. We're not going to give you something that makes you gain weight or causes cancer. We're going to give you the hormones that help protect you from gaining weight, help you lose weight, and protect you against cancer. It's completely different. But doctors and patients don't understand, because they take the negative effects, side effects and problems and complications to the synthetics and say, well, I'm going to have the same problems with bioidentical hormones, and there's nothing further from the truth.
I have a very important question. How do you deal with patients when they come up to you and say, my doctor tells me to stop taking bioidentical hormone replacement therapy? What's your take on that?
Your doctor will not understand what we do. You may not understand what we do either. So how is what your doctor doing for you now working out for you? Well, it's not. I'm gaining weight, gaining fat, putting on blood pressure medicine, diabetes medicine, cholesterol medicine, and all these other drugs. I don't feel well. I can't lose weight. I continue to get worse from the drugs that they're putting me on. Great. So how's that working out for you? Well, it's not. All right. You have to change something. If you're not going to change something, you're going to continue to see an increase in the medications you're taking, which will make you feel lousy. You have to change something. What is it that you change? You optimize your hormones. But don't come back and say, my doctor says, because your doctor will not understand it. But just because they don't understand it does not mean that it's not important. As you well know, you've been doing it for more than 10 years, and you see the excellent results from your patients.
What about a recommendation for women's health if the woman has menopause? I know we normally give them estrogen, progesterone, testosterone, DHEA, and maybe melatonin if they're unable to sleep, and also thyroid.
I'm glad you didn't forget thyroid.
Oh, I would not forget thyroid. I love my thyroid.
Everyone loves their thyroid.
Yes. Would there be anything else that you would recommend for women's health when they've menopause, or even perimenopause for the matter?
This talk today is about hormones. it does not mean that diet, exercise, lifestyle change, avoiding bad habits are also not important. Sure, those are important. That's pretty obvious.
Okay, so it's lifestyle modification, it's bioidentical hormone replacement therapy, exercise is a must, it must be a daily thing.
The only days that you don't exercise are the days that you don't eat.
Exactly, that's what I put on my patients' protocols.
Yeah,
The day you eat, you exercise.
But I eat every day, well then you exercise.
So you have to exercise.
On the days that you don't want to eat, then you don't have to exercise. Sometimes people don't quite understand that, the humor in it, but it's true. I exercise 7 days a week. And if I did not exercise, I would not see any benefit to it because you will lose muscle, you will lose strength, you will still continue to gain fat. When you exercise, it will help that, but what happens is your body slows down. It slows down the metabolism. In order to help maintain that metabolism, you need to optimize your hormones. And when you optimize your hormones, all of those other activities that you do, the exercise, the diet, will help you lose the weight, lose the visceral fat, lose the subcutaneous fat, build muscle, maintain strength, energy, quality of life, and make you feel better.
I would like to talk about PCOS, polycystic ovarian syndrome. Now when we Google it, of course Google says it's 1 in 10 women, but I know it's on a rise, and now we know that we assume everyone has PCOS until unless proven otherwise. What's your take on that, Dr.
As you've heard in the courses, I will state, every woman has PCOS until you prove that they do not. They don't walk in the door and say, I've got PCOS. They walk in the door with a whole host of other symptoms, problems, and complications. And then you can diagnose it, but most doctors don't even know how to diagnose it. Because classically, PCOS is polycystic ovary syndrome, meaning enlarged ovaries or cysts in the ovaries. But 50% of the women that have PCOS do not have enlarged ovaries, and they will miss it. So PCOS, even though it has ovaries in the name of it, it's a misnomer. PCOS is insulin resistance. Insulin resistance can cause cysts in the ovaries, but insulin resistance is genetic. And the fact that only 10% of women have it is not true. What that means is many more women have it, but doctors don't know how to diagnose it. So women go untreated and undiagnosed because the doctors don't know how to make the diagnosis. They don't look for it. But if you use the adage, as you do, every woman has PCOS until you prove that they do not, you will not miss the diagnosis. And when you treat these women, they will feel and function so much better. The problem with PCOS is it can cause infertility, anovulation, and women can't get pregnant. But it can also cause weight gain, inability to lose weight. No matter what they do, they gain weight. No matter what they do, they can't lose that weight because they have insulin resistance. And not until you optimize your hormones are you going to change and reverse that.
I have PCOS. All my staff have PCOS. I'm seeing a rise in it, and it's twofolds, threefolds rise in PCOS now. And sadly, of course, everyone's given birth control pills or oral contraceptive pills, but no one looks at thyroid levels. No one is looking at testosterone levels. They're only just looking at scans, looking for multiple cysts or enlarged ovaries, like you mentioned.
The very first slide on the PCOS section that I teach in the courses, the very first slide says that PCOS is a misnomer. We think that it's due to the ovaries malfunctioning. Therefore, we make it an OBGYN problem because of the enlarged ovaries. It's not an OBGYN problem. It's an endocrinopathy. It's an insulin resistance. It's genetic. It's an endocrine disorder of glucose and insulin resistance that's causing weight gain, side effects problems. And as you well know, it's important to diagnose this early, not only to help them feel better, but unfortunately, PCOS, which is insulin resistance, leads to heart disease, cerebral vascular disease, diabetes, cancer.
Fatty liver as well.
Fatty liver, non-alcoholic fatty liver disease is all due to the insulin resistance. And every woman, as you know, that has PCOS has a fatty liver. You do an ultrasound, they got a fatty liver. Oh, well, yeah, you got a fatty liver then, okay, fine, that's great. It's due to your ovaries. No, it's not. It's the insulin resistance, and you have to treat it aggressively by increasing metabolism in your hormones to optimize your hormones to get rid of that visceral fat, subcutaneous fat, and liver fat. and kidney fat and pancreas fat that's
The
driving the
visceral fat,
disease. And doctors don't know how to do that or understand the importance of it. You do. Congratulations.
Yes. Thanks to you.
Well, you're
'cause
very
I've been
welcome.
going for the
Sure.
courses
And look how many patients that you've
yeah.
helped. And there's so many
Wow.
patients out there that can be helped and fixed and treated, but the doctors don't know how to diagnose it, and the patients do not know or realize or understand that they've got it.
And it's really hard to explain to them, oh, you don't have to have multiple cysts to have PCOS. Look at your FSH-LH flip. Look at your zero progesterone. Look at the high testosterone. But it's so difficult to educate patients. What more doctors if you can't even educate
Sure.
patients here?
Well, if the doctors don't know it or understand it, how do you expect the patients to know and
Exactly.
understand it? But this is a large segment of the population. I'm guessing at least a quarter, 1 out of 4 women are going to have insulin resistance that we term PCOS, but we should get away from that term and call it insulin resistance in premenopause.
Right.
It's an endocrinopathy. It needs to be treated aggressively to prevent the disease and illness that women are going to get in their 50s and 60s, but you can also make them feel and function so much better. And so many women that have PCOS are depressed, anxious, miserable because they're told that it's normal. It's not normal. They've got an endocrinopathy. What they need to do is change their doctors to somebody that knows and understands how to diagnose it and successfully treat it. So premenopausal women can have PCOS, but PCOS does not end at menopause. In fact, it gets worse.
It does.
PCOS is insulin resistance, and when you lose your hormones at menopause, your insulin resistance will get worse. That's why all women tend to gain weight at menopause. And the doctors don't know what to do about it. Oh, you don't want to take hormones. Hormones are bad. They cause cancer. That's the synthetic chemically altered hormones. And yes, they do cause cancer. And yes, they do cause you to gain weight. We use the same bioidentical hormones that your body normally produces. You will lose weight. You will treat and reverse that insulin resistance, and you'll protect against the diseases of aging, the breast cancer, the heart disease, the diabetes that women get when they have insulin resistance if it's not adequately diagnosed and treated correctly.
Amazing, Dr. Neal. Thank you. Is there any words of wisdom or words of encouragement for patients out there or new doctors who are venturing into bioidentical hormone replacement therapy?
So it's 2 questions in 1 sentence. Let me break it down.
Yes.
Question A, question B. So let's do question B first. What do doctors do? Doctors can get trained in this. It's just general medicine. The courses that we teach are just general medicine courses. And of course, as you know, you've heard the doctor say, it's the best general medicine course that they've ever taken. It is the best medicine course that has completely changed the practice, the quality of life of their patients, and made medicine a lot of fun. So then how do you find out about it? Well, I'm here invited to speak on behalf of a compounding pharmacy here in KL. You will see some information on that at the end of this lecture. Doctors can contact Accent Wellness to get the schedule of the courses and training that I provide, that I come over several times a year to teach doctors, like as you are so well trained, on how to prescribe, monitor, adjust, and implement a hormone program to optimize health and wellness. So from a physician standpoint, it's important to get training in this and understand what the medical literature says that we should be doing. Secondly, patients. So how do patients find out about this? So the patients will listen to this conference, or this lecture, this talk that we give, and they go, well, that's great. We understand the concept of optimizing your hormones. There's health benefits, there's feel-good benefits, but how do we do it? And does it apply to me? If you're over 40, it applies to you. Definitely, whether you're a man or a woman. Optimizing your hormones is going to make you feel better, function better, and be great for your health. How do you go about doing it? Do not expect your family doctor to understand this. Even though you're a family preventive medicine doctor, most doctors do not understand this. They've not been taught or trained. They know nothing about it. If you go and ask your doctor about it, they will not know anything about it. If a doctor's not up on it, they're down on it. Doctors are not up on this. They may be down on it because they don't know about it. Their egos will get in the way and say, no, you don't want to do that. Hormones are bad. No, that's Prem-Pro. Don't extrapolate synthetic drugs with replacing bioidentical hormones and optimizing your levels. Every study shows there's benefits to it and there's no harm. Well, it's amazing if there's no harm and nothing but benefits, then why isn't everyone doing it? They don't understand it. It's not a concept that they learned or have been taught, which is unfortunate. So, same for the patients. You can contact Accent Wellness and you can find a doctor that has been trained in this by us that you can go see and have the hormones prescribed for you. So contact Accent Wellness. They will give you a list of doctors that you can go see and have your bioidentical hormone program implemented. From a patient perspective, you should find a practitioner or doctor that knows how to diagnose and treat. From a doctor's perspective, there is no better preventive medicine that you can incorporate into your practice. And that's why I'm here to try to teach and train physicians for that. All right. Hey, thank you for having me.
Thank you.
I hope it was fun.
Much,
You're very
Dr. Neal.
welcome.
Thank you very much.